Now, this is precisely why machine learning approaches have become so important in healthcare AI. And they can learn these individual patterns and adapt their behavior accordingly. Now, let me just step back a little bit. So, artificial intelligence is this big umbrella, and it has a smaller umbrella called machine learning. And within that umbrella is also called deep learning. So, much deeper, much deeper into the mix, right? So, let's look at this right now. Let me actually see if I can expand this image so you will understand this a bit better. So, you can see over here that we're looking at artificial intelligence that is this big blue circle. There's this big blue circle. And then you have machine learning. So artificial intelligence is the big blue circle. The machine learning is the green circle. And you have deep neural networks. This is this shaded area over here. So artificial intelligence, then machine learning, and then deep below you have deep learning neural networks, and we will go over that in this lecture as well. Again, machine learning is a subset of AI, the subset of AI that learns patterns from data rather than from explicit rules. It does not do rules, does not do explicit rules. And the healthcare data could be anything: EHR records, medical imaging, lab results, vitals, patient outcomes, so many things. It could be ED throughput, it could be staffing needs, anything could be part of this. Now, the clinical impact here is that it can predict conditions early, much before traditional methods. It can help you plan things out or manage the patient. Let me give you a concrete example. Now, we know sepsis, and people will look at the books and sepsis criteria. You have the WBC count, you have the heart rate, and you have other factors, right? The systolic blood pressure, etc. But nowadays, a system may learn that particular combination of factors. For example, those variables, as well as, let's say, a slight increase in the heart rate variability. The heart rate is going up and down, combined with a modest elevation in lactic acid, or a decrease in urine output, decrease in the urinary output, and a change in the frequency of nursing assessment. The nurse has to somehow go and see the patient a little bit more. All of this predicts sepsis development 6 hours before traditional criteria of sepsis. Now, this is where the goal is. This level of early prediction capability can be life-saving, and sepsis mortality increases significantly each hour of delayed treatment. So identifying at-risk patients before they actually develop sepsis, based on our older criteria, it can dramatically improve patient outcomes, reduce the amount of money spent on healthcare, increase patient satisfaction, and whatnot. I think now you see with this example what machine learning can really do to healthcare and improve everything from robotics to diagnosis to treatment options. However, it is important to understand that machine learning isn't magic. The quality of the predictions actually depend entirely on the quality of the training data and the appropriateness of the algorithms that are being used. And we're going to talk lots about algorithms after you learn these basic aspects. So garbage in means garbage out. Garbage coming in this way, it means garbage out. You will not have a good model. And it could also mean that a model worked on a different hospital or a different setting. It may not be working in your clinical setting. The model is probably trained on data from a tertiary care network in the heart of New York or San Francisco. However, you are in rural Arkansas or Oklahoma or anywhere else, that model may not necessarily work for you. So that's why you, the human in the loop who is in Arkansas, who is in Ohio or rural Pennsylvania, that's where you come in to tailor and target the AI for your needs, for your particular location. So this is where you, the human in the loop, is going to be coming in if you are in that particular situation. Now, let me show you two powerful examples of machine learning in action that demonstrate the real-world impact that these symptoms can have on patient care and clinical outcomes. Our first example shows pattern recognition in imaging, in medical imaging, specifically for pneumonia detection in chest x-rays. And in this program, I'm actually going to guide you through developing your own model for looking at images, just not for pneumonia, but other medical lung problems as well. That's going to be part of this program. So stay tuned. Now, ML models have been trained on millions of labeled X-rays that can detect pneumonia with 91 to 93% accuracy. Now, this term labeling is very important. This is the beginning point of your data collection and your data. The data has to be good. Now, let's say I'm a radiologist and my friend here, Steve, is also a radiologist. I'm not sure if Steve is here. I'm hallucinating, just like AI sometimes. I think that is multi-lobar pneumonia. No, but Steve, the rheologist, says that that is interstitial edema. It is not pneumonia. That could be a problem. So when you are labeling, and this is very important to understand, when you are training an AI, you have to make sure that your labeling is standardized. That everyone thinks that that image is of pneumonia. It is not. It is not interstitial edema. Now, this is very important. Now, let's just go back to the lesson. Now, in the long run, if it is based on standardized labeling practices, then this could detect patterns that radiologists might miss or may take a little bit longer. And this can be done automatically. Now, this reduces diagnosis time and has been known to reduce diagnostic time by around 60%, accuracy by 90 to 91%, and reducing diagnostic time by 50%. Now, AI also trains by looking at all the pixels, and it can determine which patterns and learn from these patterns what is normal and what could be pneumonia or interstitial edema for that matter. Now, the second example demonstrates predictive analysis for hospital readmissions. We talked about that, and let's look at this right now. So machine learning data can integrate multiple data points from electronic records, from county records, from the environmental records, from weather.com perhaps, from your calendar of events for holidays perhaps, and local holidays and external holidays, everything, the positioning of the moon, the full moon, everything, it can bring it together and give you a readmission assessment and risk scale for, let's say, people for 30-day readmissions, because we know in the US that 30-day readmissions is being monitored and hospitals get penalized if you get a patient readmitted to the hospital within 30 days. Of course, there are lots of caveats. But let's just look at this, and machine learning can greatly help you figure this out. Let me see if I can expand this for you over here. So healthcare predictive analysis. So you are plugging in age, comorbidities, lab results, medication, vitals, and as I talked about, weather information, right? So is it cloudy? Is it rainy? What is it? Is it sunshine? What is it? And you get an AI prediction, and you can have multiple actions. You can have clinical alerts. You can adjust your care plan. You can work on resource allocation, and you can take preventative measurements. Let's say if you had a high score, you can do all of this based on putting all of this information into your machine. And the impact on healthcare outcomes and healthcare costs can be substantial. And hospitals using these systems have actually reported reduction in readmission rates by up to 25%. And this not only improves patient outcomes, but also reduces costs for both the patient as well as the healthcare system, especially given that the financial penalties associated with excessive readmission rates under value-based care models. And hey, why wouldn't you want to be a healthcare system that says, hey, our patients don't come back to the hospital, they stay well, they stay healthy, and they stay in the community. And now that we understand what machine learning can accomplish, let's explore the three fundamental approaches to machine learning, and each of which has its specific applications in healthcare based on the type of data available and the clinical outcome that we are looking to solve and address. Now, the first approach is called supervised learning. Now, it is trained on labeled data. We talked about what labeled meant, right? Labeled meant that it is mentioned what this is. This image is this. This lab work is this. So it's labeled data. And again, medical image diagnosis. And this involves training systems with label data where we know the correct outcomes. Label means outcomes. Label, let me just write this down. Label means this is what outcome you are saying this has. This is pneumonia. This is heart failure. This is a lung nodule. This is a brain tumor, right? Just being very layman here. Now, basically, the machine guesses based on you are providing that these are blue squares and these are red triangles. You already provided this information. You have good data with you. In other terms, think of this learning is when a teacher actually provides the right answers during the training process. The teacher is providing you with the answers. The doctor is providing you with the answers. Now, the system basically learns to recognize these patterns. They learn that these patterns are associated with each category, and then it can classify each of them separately. And when it sees them again in real world settings, it is able to recognize these patterns. Now, unsupervised learning and unsupervised learning takes a fundamentally different approach. And it does by finding patterns in data without predefined labels. There's no labeling that this is heart disease or this is pneumonia, this is interstitial fibrosis. There's no labeling. The system analyzes the data and identifies natural groupings or structures without being actually told what to look for. It can identify different patterns. Now, to give you this example with this chart over here, unsupervised learning, you're not labeling them, but the data is still there somewhat. Let's take, for example, you have a diabetic population, you have an EMR, it has loads of information about diabetic people, and they may be taking insulin, they may be on metformin and not taking insulin, or they may be just patients being treated by lifestyle modification, right? So you have the people on insulin, you have diabetics on metformin, and you have diabetics who are being treated with the lifestyle modification. Now, you have not gone through all the details. You have not gone through the charts and separated out all the charts with patients only on insulin, patients only on metformin, and patients only on lifestyle modification. You don't know any of that. You know there are people like that, but you don't really know which people are like that, right? You have this whole information, thousands of medical records, and you throw this into your system, and voila, patterns are being discovered by your machine learning algorithm. Now, coming back over here, these people could be the insulin folks. These people could be the metformin folks. And these are lifestyle people. Your algorithm is able to detect and differentiate and make categories. Now, this, my friends, is what is unsupervised learning, where it finds patterns without labels. And this is an example of patient population clustering. And the benefit of unsupervised learning is that its ability to discover novel insights that were not anticipated by human experts, or you did not know about this. And it can identify patterns that might lead to new understandings of disease mechanisms, treatment responses, or patient risk factors. And you might win the Nobel Prize for medicine. Let's say, for example, you find diabetes type 4. Now, we know about diabetes type 1, diabetes type 2, and people do call Alzheimer's disease as diabetes type 3. Maybe you're able to find diabetes type 4 and also find treatment for those groups of people and win the Nobel Prize, right? Wouldn't that be grand? And pharmacists, this is how you might be discovering newer drugs that you never saw before. People in PhD, in big universities, in research centers, they're all doing this right now and trying to figure out how to treat your diseases through newer things that were not possible before this. Now, the third approach is reinforcement learning, and this involves learning through trial and feedback loops. Now, the system learns by taking actions, observing the results, and adjusting the behavior or doing a response based on those outcomes, and whether it's positive or negative. Okay, let's say, for example, a patient with, again, let's look at sepsis, that blood pressure needs to be more than 90 systolic, perhaps, let's say. And if it goes below 90, that's a negative outcome. If it goes above 90, that's a positive outcome, or it could be any outcome that you have labeled into your system. And I'm going to give you an example of this in more detail. And the choice of all of these approaches that you may look to apply depends on the clinical problem, the available data that you have, the type of data that you have. It is labeled, is it not labeled? So a successful healthcare implementation actually will be a combination of all of these approaches, supervised learning approaches, unsupervised learning approaches, and of course, reinforcement learning.